Hi everyone, my name's Raphaella Stander and I am a general pediatrician in Cape Town, South Africa. I have a special interest in pediatric rheumatology, but I've spent a lot of time in the rheumatology department and met my first FOP patient who was a pediatric patient, and that really got me into learning about FOP and the FOP community, and that is what has driven me towards running 2 of the clinical trials here in South Africa. There's so many people that haven't even heard of the diagnosis. I mean, I recently just had to explain to a medical aid insurance, I think you call it in the States, call it insurance, but yeah, we call it medical aid, what FOP is. They'd never heard of it. And yeah, I think you need to really educate the frontline people, the people that are going to see them for the first time and might do an unnecessary biopsy or invasive procedure. I think, raising awareness and getting those people on the front lines to actually even know what FOP is, so that they can connect to, the bigger centers that can guide them through the process of looking after a patient, getting them access to what they need. But I mean, even in a very well-run Western Cape in South Africa, it's difficult. We have to reach out to all our international sources for even just access to a wheelchair. So I mean, we've also, Tin Soldiers have done huge amounts of work for us here in Cape Town, South Africa, with our FOP patients. Being in Africa and isolated, international resources and guidelines and webinars are really useful. And that's where I've learned most of the information about FOP. There are loads of resources. So the ICC guidelines and the FOP website have all been very valuable assets to me. And yeah, you don't need to know everything. You just need to be willing to learn and learn about the disease and the complications. It really taught me to slow down, because you really have to think about each process and procedure, and you really need to think about minimal trauma and not harming your patients. The one thing I've learned is you're not alone. You need to work with a team, and yeah, you should reach out to multiple members in the FOP community. And I think one of my biggest learning curves was that actually you learn the most from your patients and their families, and they really have taught me the most about FOP. Just every single patient that I've met with FOP have these amazing stories. I mean, one's a scientist, one makes incredible jewelry out of wood, the other one plays piano, and I mean, you can't even see the keyboard, but he literally can play the most amazing piano. So I always say they have superpower brains. Patients with FOP, they're just so amazing, and you learn so much from them. So they really are incredible people, incredible stories.